Hello, everybody. I am Carrie. I work really close with Tion, and I'm going to be helping with the tech and a few of the other things during the event tonight. So I know it's about 2 minutes until we start. We're just getting a couple things organized, but I want to make sure we start on time. Could y'all let me know if you can see us? Okay, we are kind of popping around. And give me 1 second. I'm opening up a different computer so that I can get questions to come through. So it's getting a bit of an echo. But if y'all can raise your hands, if you can find the hand raising, that would be brilliant. Just if you can see the hand raising if you're here, and if you can let me know that you can see us okay on the video and you can see the presentation okay, that would be brilliant. That way we can help anybody who can't see it. Awesome. Thank you so much. Can you turn the sound completely off? All right. We'll get started in 1 minute. If you guys have any specific questions you want to ask too, I love when we get questions, and Tion loves getting questions. It's one of the best things we could possibly do. So if y'all have any questions and you want to pop them in the box as it pertains to maybe you've got some symptoms you want to talk about, or you want to get some answers on something, this is a really great opportunity if you want to pop some questions in as we are about to start, and then we'll jump in just a minute. You can come up now. It's not working. You don't have questions for some reason. All right. All right. So I'm just going to pop this open over here. Okay. So we can both see the questions as they come in, but we're going to focus on this. Okay. So everybody's here. Okay. Oh, that's okay. Okay, Sharon, you sent a big email. We love long emails. Maybe you can type it and make it a little short so we can answer here. That would be brilliant. If it's pertaining to your symptoms, that would be awesome. So, all right, we're going to go ahead and we're going to jump in. I just want to make sure that I've got everything recording on my end, which yep, we're recording. We've got everything ready to go. So thank you, everybody, for being here. Just a couple of sort of quick housekeeping so that y'all know how we're going to run the session tonight. So we're gonna go through lots of information. Then at probably toward about 3/4 of the way through the presentation, we're going to get some questions. We're going to do some questions with Tion where you guys can ask specific questions. If you have questions as we go, please type them in the questions box. It actually says questions in there. I'm not always, sometimes I see the chat, but questions are so much better. I'm going to help technically along the way. I'm Carrie, and then if there's something like you can't hear something or something like that, let us know in the questions box. That's probably the best place, okay? So tonight we're going to be talking a lot about bacterial inflammation and peri and post menopause. This is a topic that I'm the clinical researcher, and I do a lot of the patient onboarding. In fact, I've probably spoken to some of you guys here tonight. And a big reason why I wanted to talk about this is because we're starting to see a lot of patients that are coming through that have seen other naturopaths for years, or they've gone to integrative doctors. And what's really scary is we're starting to get patients through that are currently sitting on bioidentical hormones, or they might still be on like HRT or progesterone, and they've been on it for 10 to 15 years. And they're starting to have symptomatic effects even on the medication. So bacteria is a really big topic as it pertains to peri and postmenopause, and the symptoms are the clues. So we're going to go through lots of this tonight. If you don't know Tion, let me just quickly introduce you, and then I'm going to have her jump right into the presentation. So like so many, Tion actually had Hashimoto's, and it took 4 different doctors for her to go to actually get her diagnosis of Hashimoto's. And she was basically told, good luck getting pregnant, good luck with your Hashimoto's. This is an autoimmune condition that you're just going to have to live with. And literally, she had to push through just to get the answer that it was her antibodies, right? Like we hear this story a lot where patients are not getting answers. So Tion lived this, and this is a big reason why she now is our clinical naturopath and our director here at the Naturopathy Clinic. And she has really dug deep into the work. She trained over 120 naturopaths. She's been mentored by some of the best integrative doctors, medical doctors. She's been able to bring on some of the best doctors into our clinic. And she even went so far, she not only did she notice it's happening hormonally, but now it's starting to manifest in a lot of kids. So all of this has come together to really bring a functional, naturopathic, herbal, and nutritional approach to treating women and children, okay? She specializes in bacteria and hormone treatment, and really we combine that bacterial, and you're going to see why in just a tick. You'll be like, wow, I can't believe more people aren't doing this, because it's such a big part of it, right? And we do a lot of hormone treatment as it pertains. If any of you have had endometriosis, if you're currently here, you probably have you've had perimenopause or postmenopause, or you're in the middle of menopause. Maybe you have a history of menstrual-related issues, a history of infertility, thyroid conditions, autoimmune conditions. This is a lot of what she's really good at. So without further ado, Tion, thank you so much for being here with us tonight.
Thank you so much for having me, everyone. I've been really looking forward to doing this webinar because it's on a topic that I'm really, really passionate about, and it's on a topic that we're getting really fantastic results in our clinic. Like Carrie said, we see lots of women with female reproductive conditions, menopause, thyroid, and we're also seeing children as well. And a lot of the patients who we are seeing, they have seen other doctors, they've seen other naturopaths, they've seen other alternative healthcare practitioners, and I truly believe that not the only reason, but one of the reasons why we're getting fabulous results in our clinic is because we do a lot of work with gut health and the gut microbiome. Now, just to give you a little bit of a background of where I come from and my educational background. So I've got a Bachelor of Health and Medical Science. And when I studied the medical science side of things, when I studied female reproductive hormones and menopause, it was all about the hormones. And we learned about menopause and perimenopause and postmenopause and how that pertained to our hormone levels and you know, the symptoms of perimenopause and the hot flushes and the mood changes and the fatigue and the mental fogginess and the sleep disturbances and how that was related to our hormones. But actually, the reason why our hormones can go a little bit haywire perimenopausally and menopausally actually stems from the bacteria and the microbes in our gut. So I just want to dive a little bit deeper because I think this is one of the reasons why we're seeing fantastic results in our clinic, is because we are looking at the bacterial balance in our gut microbiome.
Yeah, so just really quick before we jump in, one of the big reasons we're kind of really shouting to the rooftop on this is right now, I don't know if any of you guys are aware, but the Daily Mail is doing a 30-day series trying to push the NHS in the UK to re-educate doctors on menopause. And the reason that this is such a big deal, like in the last year, there's been 2 major documentaries that's been put together. There has been so much information that has come out about the role of bacteria showing up and manifesting during perimenopause, and it's a really important time, and through menopause. And if you catch it early, you've got this window of opportunity to have early detection of Alzheimer's, dementia, arthritis, breast cancer, ovarian cancer, and cervical cancer. And for me personally, my mom suffered from extraordinarily bad headaches. And when you actually see the driving causes of headaches during perimenopause and menopause, it's pretty amazing to realize that had she actually been able to deal with that all those years ago, she probably wouldn't have such bad arthritis. She's had to have 2 knee replacements, and my mother-in-law's had 2 knee replacements and a shoulder replacement now. And what if all of this, and it's looking more and more like all of this could have actually been detected early on. So this is a big reason why we're screaming about it. If you have symptoms, don't just put them aside. Please don't just think that you have to accept the answers. We really want to help you see a totally different way. Okay, so just to kind of give you some context, the Naturopathy Clinic, Tian is our clinical director. I do a lot of the research. Oh, can you not see Tian's face? Okay. Oh, Tian's face is covered by the slides. Okay. I'm not sure if I can fix that right now, but I will try. We can turn the slides off in just a tick, okay? Basically, we have integrative medical team. We have naturopathic practitioners, naturopathic doctors. We work with endocrinologists. We do functional pathology. We do gastrointestinal pathology. And we have clinics across Australia, New Zealand, and the US. And we have a combined experience of over 100 years. And that's what we're really bringing to the table. So Tian, let's get right into it. So we want to keep the slides open. Because it's really there, you guys are going to be able to follow along, and we want you to see where we're talking about. And ideally, along the way, we do a lot of symptomatic conversation. So we want you to take notes and see how you can start connecting the dots as to what is going on. So go for it, Tian.
Okay, we'll move the computer, so hopefully you can see my face now that it's facing more to the computer. So how we see hormonal imbalances in our clinic. So we're very symptoms focused. In fact, quite often things don't pop up on any pathology report until it's actually a problem. And it's the symptoms that are telling us that something's out of balance. So we do look a lot at pathology, but we're very big on assessing the symptoms as well. Of course, we are going to look at the bacterial composition in the gut microbiome, hormonal dysregulation, nutrient malabsorption. Now, if there is any dysbiosis, so dysbiosis is basically a fancy word for an imbalance in the bacteria and the microbes in our gut. So if there is any bacterial overgrowth or dysbiosis, that is going to affect our nutrient absorption. Opportunistic bacteria, when they're given the opportunity, they can overgrow, and they actually feed on B vitamins and iron, and it's those B vitamins, particularly B6, that's really, really important for the balance in our reproductive hormones and shifting us into menopausal years. So that's a massive factor there, how that it does affect our B vitamins and our iron. We can look at further diagnoses and as well as high inflammatory markers as well. So why does inflammation and bacteria act up from the age of about 38? So there are a few reasons here. So number one, the main reason why there can be inflammation, and particularly stemming from the micro and the gut and the microbes in our gut, is we do have an increased methanogens that produce from the gut microbiome, and those methanogens actually slow down gastric emptying, and it actually slows down our digestion. So we are more prone to things like constipation, bloating, and gut symptoms. So a poor period history as well, things like endometriosis, heavy periods, clotting, PCOS, things like that do exacerbate our symptoms menopausally and perimenopausally as well.
And these are, can you just briefly, for like just 60 seconds, talk about these symptoms have so much to do with bacterial inflammation. So when they get into perimenopause, we see a lot of women that are in the middle of that are just hitting this. If any of you are between 38 and even up to 45, and you're starting to have like symptoms like headaches, clotting, heavy bleeding, pain during sex, or a resurgence of symptoms that you had when you were on birth control, but you're still on birth control, can you just talk about like why is estrogen and why is the estrogen at this perimenopausal time showing up? So like why are these symptoms showing up so much during this time?
That's a really interesting question, and it all stems from the microbes in our gut. Mostly stems from the microbes in our gut and our liver. So we do have an increased dysbiosis as we do age, which is going to further exacerbate our hormone metabolism. So that's really important for our hormone metabolism as well as our liver. So our liver is responsible for the manufacturing and the detoxification of our hormones. So they're the main reasons.
Okay.
Okay, problem 1, estrogen dominance. So this is something that we see so often in the clinic. So the main symptoms of estrogen dominance include weight gain or the inability to lose weight. So estrogen actually stores in fat tissue. It makes fat tissue break down really hard, even when we're doing everything perfectly. And it's one of the most frustrating and irritating things to have, because patients are eating really well, they're exercising, and where there is that estrogen dominance, it does affect fat breakdown. Estrogen dominance can also cause period pain, period cramping. One of the first and foremost giveaway signs and symptoms for estrogen dominance are sore and tender breasts. So that's usually the first question that I do ask my clients when I'm trying to assess if there is estrogen dominance going on. We've also got moodiness and changes to our mood when we are in an estrogen dominant state, menstrual clotting, and trouble sleeping.
And the trouble sleeping is a really big one. And a lot of the big myth is that women think they have low estrogen when a lot of the times it's quite the opposite. And estrogen dominance, can you just kind of talk about estrogen dominance also is a sign of low progesterone, isn't it?
Yeah, absolutely. In most cases, like not always, but it's usually because progesterone is low. The other thing that estrogen dominance does, it increases something called, and this is getting quite technical, but it does affect, it will make sense in a minute. So high levels of estrogen increase something called beta-glucuronidase in the gut. And when we have high levels of beta-glucuronidase in the gut, that's an enzyme. It actually impairs our detoxification capacity. So not only do we have this high estrogen dominant state, it's actually like throwing fuel on the fire, because it's further exacerbating that beta-glucuronidase, which beta-glucuronidase impairs detoxification, and we need detoxification to detoxify estrogen. So it's just like this snowball effect as well.
And then when the liver is, the reason that I want to ask questions about estrogen dominance is because it's a big reason why the gut, you actually realize estrogen is a communicator that there's something wrong with the gut microbiome, right? So like when estrogen is doing that, and when that happens to the liver, I didn't actually realize that about the liver, then how does that stem back to the bacteria?
So, well, the bacteria is responsible for the metabolism of estrogen. And so that's how it stems back through the beta-glucuronidase.
And that's why it affects the liver, and this is why these symptoms start to pop up. Okay, that's fascinating. Okay. Now we're going to move on to the next problem.
Thyroid, metabolic conditions and thyroid hormones. So we see lots of hormonal, like estrogen dominance, thyroid conditions, insulin resistance, which we're going to talk about in a minute, and they all kind of have overlapping symptoms. And in fact, they all, you can't have a healthy thyroid and have issues with the reproductive hormones. You can't have perfect reproductive hormones and have issues with the thyroid. They work together in synergy. But the main symptoms where thyroid is the main cause, we look at fatigue, weight gain, can't think straight, like can't get words off the tip of your tongue, fatigue, exhaustion, changes to the menstrual cycle, and changes to our sleep. So just to briefly explain how the thyroid works, and I just want to touch a little bit on here about blood test results. So the thyroid is the butterfly-shaped gland that sits here in the throat. It's the pituitary gland that actually stems from our brain that produces TSH. And that's the only hormone that's tested, generally speaking, on standard blood test results. And unless the TSH is out of range, they don't go and further test the other thyroid hormones. We've actually got T4, T3, reverse T3, and then 3 thyroid antibodies that we need to look at and assess to see if the health of our thyroid. So the hormone that they're testing, it's not even a thyroid hormone. It's not even telling us the function of our thyroid. The other thing to remember as well is we actually only have 18% of our thyroid hormones in our blood. The rest of our thyroid hormones should be inside our cell, and that's where it works at the cellular level. So blood test results are really only a part of the puzzle. We really need to become detectives when we're looking at thyroid hormones and look at other factors that might be affecting how thyroid hormones can get inside the cell and work at the cellular level. One massive factor that actually prevents this from happening is estrogen dominance. So high levels of estrogen bind to something called thyroglobulin binding protein, which prevents it from entering inside the cell, which can give us those underactive thyroid symptoms as well.
And thyroid is a really big part. So one thing to be aware of is if there's underlying thyroid issues, again, it can be a fire starter that you're not even aware of, and it's where the slowness and a lot of these symptoms come from. So I wanted to bring this into the conversation because a lot of y'all here tonight, you would have read our book, Peri-Menopause, or you've heard a little bit about it maybe. And one of the things that's a big thing that starts to show up is, I call it the triple whammy. That's a very American way of putting it, right? But basically, it's this perfect combination that then can get super exacerbated as you get into, if you have any underlying bacteria. And we're going to talk about the bacterial effect of insulin resistance, which some of y'all probably didn't realize that there's key bacteria, which she's going to talk about in just a second. I learned about it and I thought it was fascinating, so I asked her to talk about it. So let's just briefly talk about, like, is it thyropause or is it bacteria? Just talk through what the thyropause symptoms are.
So going through thyropause, it's our thyroid hormones can decline between about 2 to 5% as we're perimenopause, and there is an increased risk of an underactive thyroid and insulin resistance perimenopausally. So basically, just in a nutshell, what insulin resistance is it's so when we eat sugar, it sends signals to our brain, and our brain tells our pancreas to secrete insulin, and then insulin binds to the sugar molecules, and it acts as like a little shuttle to enter those sugar molecules inside the cell, and that's where it's burnt as energy. What happens in insulin resistance is that's when the cells are so full of sugar already that the insulin can't actually insert any more glucose molecules inside the cell. So as a protective mechanism, a layer of fat wraps around that molecule of sugar, and it stores around predominantly the middle for later use. And this just keeps happening until, eventually insulin resistance is a pre-diabetic state. There's a massive component of blood sugar, carbohydrate metabolism, and insulin resistance that's actually stemmed to the microbes in our gut. So there aren't many, but there are a few bacteria in our gut that are actually specifically responsible for the function of insulin and the metabolism of carbohydrates. And those bacteria are associated with insulin resistance, obesity, diabetes, sugar cravings, all of those metabolic symptoms.
And we're gonna talk through a patient who's actually had it in just a second. So to keep you moving, so we stay on time. What is this? So this is a big one. A lot of women, like for me, I went to the doctor, and the doctor's like, yeah, you're all within normal ranges. I was so fat, and the only indicator that I had coming from the doctor was high cholesterol. And this is becoming really common. The high cholesterol and the blood pressure are, like, can you talk about how they could tell the people that are with us today, how they could tell them that maybe that means something's not quite right.
Yeah, so I always look at high cholesterol as an indicator because it's something that's very, very easily brushed to the side, or unless it's severely elevated, you're medicated with. So we need to look at the microbes in our gut when it comes to high cholesterol and liver. So the liver is responsible for the manufacturing of those steroid hormones and the release of those steroid hormones through the blood, and then it goes to the digestive system, and that's where it's all metabolized. So where there is high cholesterol, that's an actually impairment in our liver function and the bacteria in our gut. Where there's an impairment, particularly the function of the liver, that's catastrophic for reproductive hormones and thyroid hormones.
Oh, wow. That's cool. All right, so let's keep moving. So let's talk, this is the story I wanted you to tell.
Okay, so Carol is one of my lovely patients. We've been working together for a few months now. She has very generously allowed me to use her story, and she's a fabulous patient. And so the reason why she presented to me was she has, for the last 15 or more than 15 years, actually, she's been going to practitioner, to doctor, to gym, to nutritionist, to all sorts of practitioners because she has gained a lot of weight. She's about the 100 kilogram mark. She's got IBS. She swings between constipation, diarrhea. She suffers from really, really bad reflux. She's got a lot of breast tenderness and those menstrual issues going on as well. And nothing has been working for Carol.
Oh, we went in the wrong direction.
It's okay.
This is the insulin zone of misery.
Yeah. So we actually sent Carol off for further tests, and we found out that she had insulin resistance. So she actually came to me because she thought she had an underactive thyroid. And we did send her off a further test to have a look at her thyroid, and yes, there was a decline in her thyroid hormones. That is something that we do need to work on. But she was actually in a diagnosable state of insulin resistance. So I just want to throw in here the difference between the symptoms between insulin resistance and thyroid, because they do kind of overlap. So when we look at insulin resistance, someone actually used the term zone of misery, and I absolutely loved it because it's such a good term to encompass what it actually means. So you know those times when we might be feeling absolutely fine and then suddenly we crash. We might be talking to someone who we've known for 20 years and we can't for the life of us remember the name of that person. We might walk into a room and we have no idea why we walked into that room. We completely forget. We're completely foggy. So what we need to do as natural human instincts to get ourselves out of that zone of misery or that massive crash is we grab for stimulant starches, and sugars to kickstart our brain out of that zone of misery. Then 30 minutes later, we have elevated our insulin because we've gone for something sugary or carbohydrate-y, so our insulin levels have spiked, and then 30 minutes later we crash again, and then we're back in that zone of misery. And then this just cascades that insulin and blood sugar dysregulation, weight goes on around the middle, and it just keeps cascading. It just keeps going on as a snowball effect. And Carol was actually experiencing those symptoms. She came to me because she has a family history of thyroid issues. She really felt like her issues were thyroid related. And I thought, okay, I agree, like let's look into that. And she was right, but her main issue was that significant insulin resistance. Okay, so we also did a GI map and we looked at the bacteria in our gut. So we can look at all of the opportunistic bacteria, the beneficial bacteria, if there's yeasts, parasites, candida, H. pylori, if there's leaky gut or if there's any resistance to certain antibiotics. So she was experiencing significant bacterial inflammation in her gut. There were a lot of UTIs, thrush, bacterial vaginosis, headaches. So when we see headaches, it's usually stemming from the permeability and the bacteria in our gut. Mood as well. The reason why a lot of patients have a very strong shift and changes to our mood is because that opportunistic bacteria produces toxins and endotoxins, which are actually affect our neurotransmitters, and they're quite toxic, and those chemicals can interact and cause depression and anxiety and mood changes. Joint pain as well, so that it just throws us into this very, very strong pro-inflammatory state, which can lead to headaches, joint pain, muscle pain. Low iron or vitamin deficiencies, so this opportunistic bacteria loves iron and B vitamins, but vitamin B6 is a key one here. Vitamin B6 is necessary for very healthy hormone metabolism, and that opportunistic bacteria just significantly reduces that.
So this I'm going to Q&A you with, okay? And guys, along the way, I see your questions. I want y'all to know we're going to come back to them, but I would just want to kind of get through some of the content, and then we're going to come. But I hope you're getting a lot from it that might even be answering some of the questions. One of the big topics, and this is heavy on my heart, and this is heavy on just the last few weeks. We've just had so many people coming through that have seen other doctors, that might have even seen an integrative doctor. They're paying $250 an hour. They've been doing it for a while, plus they're paying for the medications, and they haven't ever addressed the actual bacterial side of it. So I wanted you to go through like the medical solutions when these things start to pop up, because these are some things that you can start to identify, or for those of you who are postmenopausal or you're going through menopause right now, if you can start to catch some of these things, look back on it, there's so much we can do. We were just talking Tuesday, about in 7 years, you can completely change your cell, right? So like, you still have time. You can still catch it. Like, good on you for everybody being here right now. You know, you've probably just got off of work. Like, this is a real key window for you to actually start to go into solution mode. So can you just quickly go through, like, if some of these things pop up, these are the kinds of things they're going to hear either as a diagnosis or just briefly.
Yeah, so the medical intervention for all sorts of menstrual issues, perimenopausal symptoms include things like the IUD, Mirena, birth control, a diagnosis such as fibromyalgia, and then the medical treatment for fibromyalgia is just pain relief, and then early recommendations for hysterectomies. Now, the amount of women who we see who have had bleeding issues, they've gone on to some sort of birth control to control the bleeding, and that wasn't necessarily working, so they had a hysterectomy, when in actual fact they just had a significant amount of gut dysbiosis going on. Now, I have barely spoken about something called SIBO, so in this webinar. So SIBO is small intestinal bacteria overgrowth, and there's a high association with SIBO and hysterectomies, which is insane. really interesting. And we're seeing loads and loads of patients who have SIBO, and we're able to treat it effectively with really long-term treatment plans as well. And I've read a few articles and a few studies saying that most patients who have had hysterectomies have had a significant imbalance in the microbes in their gut, and they've had small intestinal bacteria overgrowth. That's when the opportunistic bacteria moves to the small intestines and causes a significant amount of inflammation there. So, and like Carrie said, like, there's so much that we can do now that can completely eradicate so many issues going on in the future. So I want to talk about Carol's results, because I was so excited to 3 months later, or even before 3 months later, to see how much weight she's losing, to see how much she's feeling better. So
just talk about what came up on her test.
Oh, sorry, I need to talk about, so I'm glad we've got Carrie here. Okay, so we spoke about the insulin resistance. She was also significant estrogen dominance. Again, like I said before, estrogen does store in fat tissue. It makes fat tissue breakdown really hard. Not only does that estrogen dominance make fat tissue breakdown really hard, it also impairs our detoxification capacity. When there's an impaired detoxification capacity, that's going to affect our liver. When we've got a sluggish liver, that can make us more prone to storing on weight or gaining weight. She had a significant amount of gut dysbiosis, so too much bad bacteria, not enough good bacteria. She had something called H. pylori. Now, 50% of the patients have H. pylori. So H. pylori is something in the upper digestive tract, and this actually reduces our stomach acid. We actually want our stomach acid to be really high because it's that stomach acid and it's those digestive enzymes. They're our first line of defense. So when we're consuming foods that have bacteria in it, or breathing in foods, breathing in things, or touching surfaces, and then eating with our hands, and we're constantly consuming bacteria, and we need those enzymes and that acid to be really high to kill that. So when that acid is really low, we are prone to things like H. pylori and issues further on.
So what and how do we actually fix the problem? So let's get into this a little bit. I'm going to drive a little bit, and I'm going to do a bit of Q&A with Tion. And I'm also going to start bringing in some of you guys' questions at the same time, okay? So in a minute, we're going to do some Q&A. So if you guys have any specific questions, Sharon, I've got your question. Amrit, thank you for letting us know about the video. Michelle, okay, Catherine has a good question. Oh, this is a really good question. Chelsea, really, really good question. Okay, so let's actually just go ahead and let's do some questions, and then we're gonna get into what are we actually doing to fix the problem, because it's all good and well to know everything that's wrong, but now how do you actually get it better, right? Like, that's really what we're here for. So if any of you here, I only have a few questions here, which is a shocker. So if any of y'all want to ask questions, please pop them in the questions box. If you're having a hard time finding the questions box, then just raise your hand and I can help you find it. But in the meantime, we're going to come straight over to the questions that we do have, okay? So I'm going to start with the young one in the group, and then we'll kind of go upwards, because I can tell y'all by age by your question. But Chelsea, thank you for telling us, okay? I'm not going to say your exact age, but she's getting at that early stage where things start to act bananas, right? So Chelsea has a history of endometriosis, 2 surgeries, 2 children were easy. You tried for the third at 35. For 18 months, you weren't able to naturally conceive. My usually heavy periods with mid-cycle breakthrough bleedings and clots have suddenly become very light. 4 months now. I'm very confused. Do you know what can be causing this? So can you just briefly talk about endometriosis and the bacteria?
Yeah, so endometriosis
and estrogen dominance.
Yeah, so hormones are highly affected in endometriosis, but it's not actually a cause of hormones. It's actually the 2 main causes of endometriosis are an inflammatory response stemming from the bacteria in our gut and our immune system. So what actually happens in endometriosis is, or what endometriosis is when we get a period, naturally our estrogen levels surge. And then when that estrogen levels surge, the endometrial lining in our uterus thickens, and then the estrogen levels drop, and that's when we have to bleed and shed the endometrial lining. So what happens in endometriosis is that endometrial tissue leaves the uterus and it deposits in other parts, and it causes significant amount of inflammation. So,
and why does it come up during perimenopause? Because this is, so Chelsea, I'm making a big deal because we hear it, the perimenopausal time and endometriosis, it's almost like you have what I call a resurgence of the endometriosis. So what's happening that she's starting to see? It's almost like our early perimenopausal signs. What could potentially, I know you can't answer that question without looking at her tests. So Chelsea, you need to become a patient, just so you know. We'll talk about that in a second. But can you just tell her a little bit about like what you're seeing that's actually, you know, like Why couldn't she conceive? Why is she starting to get, like, could something be happening that's making this set in? What do you see?
To be honest, like Carrie said, I can't, diagnose or anything, but I would be looking into thyroid hormones. So the fact that there was a lot of clotting, that's very much related to the estrogen. There's a very, very significant estrogen dominance in endometriosis, and I can see that you've with the breakthrough bleeding, the clots, and the heaviness. Of course, there's a significant amount of estrogen that's going to affect the thyroid, and then suddenly having very light periods. I'd be honestly looking into thyroid function, to be completely honest.
So that's a great question, Chelsea. So we'll, in a second, we'll kind of walk you through like what we can do to actually help you. And that this is very much, obviously, hopefully you've gotten a lot from it so far because you asked that a little earlier. This is going to be so Sharon said she's 56 years old. She has recurrent E. coli UTIs. Oh boy. We just talked about that.
UTIs.
Wow.
Yeah.
And she's on a plant-based diet, lupus, connective tissue, autoantibodies.
Okay, so it's fantastic that you're on a plant-based diet. That's really good. We get a lot of our patients to eat all of, those plant-based foods, but where there's obviously, sorry, can we go back to the question?
Yes.
There's obviously a really strong history of potentially gut stuff. If you've got lupus, there's a lot of research, or a little bit of research, should I say, not a lot of research. There's one really good research paper finding that 100% of patients with an autoimmune condition have a significant amount of leaky gut. So what leaky gut is in our intestines, we should have really, really tight gut junctions or tight cells, and only micronutrients can pass through those cells, and that's what nutrifies us. In leaky gut, there's a few causes of leaky gut. In leaky gut, it's when those cells become separated and larger food particles can pass through, and it can enter the bloodstream and cause all sorts of things. So the fact that there is autoimmunity there, I'd be looking into things like leaky gut, E. coli. There's a very, very strong link between E. coli and our hormones. Everyone thinks of E. coli and urinary tract infections, but if we actually do a fair bit more research into E. coli, there's a very, very strong link between that and our reproductive hormones, which is really interesting. So yeah, it's fantastic you're on a plant-based diet, but I think dietary is really good for preventative health. When there are deeper things going on, there's deeper interventions that we need to take than just diet-based.
Yeah. Okay. That's a good question. We're not going to talk about that right now. Michelle, I see your question, and we'll look into it. I don't think we're on that at the moment, but I don't know the answer to the question. Oh, wow. Okay. So this is really interesting. So during perimenopause, it's very common to have what's called a histamine intolerance. Okay. And I'm kind of chiming in because I literally am I talk to a lot of our new patients. I'm very lucky because I get to do all the research. So I probably spend 30 hours a week reading clinical studies and then talking to Tion about whether or not it's coming up in the test results, right? And so I'm a total nerd. So when I see this, like postnatal drip, catching colds easily, getting sick, having history of tonsillitis, all these things. So the estrogen actually activates the bacteria inside of the gut microbiome that causes it appears to be like a histamine intolerance, but it can be largely driven by I like to call it the gasoline on the pilot light, right? So your estrogen is like the gasoline and the pilot light is the bacteria. So you almost can sense, and this, like when my mom was having her migraines, we talked deeply about it because again, I wanted to understand it. And she could sense her migraines would get really intense just before she was about to start her cycle when she was in her perimenopausal years. And sure enough, she came out with tons of arthritis because she didn't treat the bacterial issue, right? And histamine is very similar. So like if you have a postnatal drip, mucus, if you don't deal with the if you don't actually deal with the bacteria, it can compound, right? So this is this is the reason we're talking about bacteria, because it plays a very big role in the perimenopause, postmenopause, menopause journey. So great question. Amrit, if you're open to it, we would love to, we'll talk about how to become a patient, but really, like, we see you a lot, and it literally, we have to do a weed seed feed to actually get rid of that bacteria, and then help introduce healthy bacteria to have the health blood flora. But it's actually pretty quick treatment, right? Like, it doesn't take very long. If that's your key thing that's happening, and there's not other bigger autoimmune issues, it's typically just a nice little cleanup and top up, and you'll never you'll feel like you're 20 again, because the amount of energy once your hormones are reset. Okay, here's another one. This is a great question. Crystals asks, I'm struggling with post-menopause hot flashes. What mainstream test can I ask my GP to start with?
That's a really good question, Crystal. Definitely doing the hormones, but also cortisol. Not the greatest standard GP test with looking at cortisol, but definitely a start. I mean, it's not the greatest standard test, but I'd be looking into adrenal health. Yeah.
And so, Crystal, we see a lot of hot flashes, but it's not, to us, it's kind of like it's like the very top line symptom. It's probably the easiest one to fix. Literally, you can turn hot flashes off like a switch in the bedroom. You know, you just turn it off and it's dark.
Yeah.
And it's very similar. You just need to get a few things tweaked. It's actually quite quick if you want some help.
I mean, we've had patients I had a patient a few weeks ago. She was having 50 hot flashes a day.
Whoa.
And I made her a bottle of herbs, and she basically went down to about 2 or 3 a day, and now she doesn't have any hot flashes.
And one thing to remember, so it's really fascinating. I did some, because again, I'm a dork. I read the entire historical creation of Pfizer, and Pfizer actually started out as an absorbent acid for vitamin C, right? So one thing to take into consideration is a lot of the treatment that we use in the beginning, like 98% of the patients get better with our nutrient support, right? So a lot of the stuff that they give you over the counter all started with a nutrient, and Pfizer's dwarfed into the pharmaceutical creation it is today. So just keep that in mind, Crystal. Maybe you book in an initial consultation and we just turn that light off for a second. Okay, is there a primary diet? So that's a good question, Tammy. Can you answer it? Briefly, we've got like 2 more minutes for questions.
We do a lot of dietary things with gut issues. So yes, but it's definitely not enough when there's a significant dysbiosis or leaky gut or parasites going on. So we do need to go in with those more targeted herbs and nutrients to get that right. So it's not the only thing, no. But dietary things for long-term solution, yes.
Yeah. Okay. Sharon, I really hope we can help you. She said she feels off balance. We just answered your question a second ago but she's saying she's feeling off balance, shaky, and as a result, and we've had a lot of patients like you where it's very difficult. Like, so we've had patients you had a patient, and I'm only saying this because Tion's actually told me, that literally got into the car and forgot how to drive. Right? So the brain fog is real. If you have bad brain fog, you can think about her, right? But Sharon, we'd love to help you. If there's any way we can help you, let us know. We'd love to help you. Is there a way to confirm the relationship between low iron and gut issues?
Yes, there's definitely quite a few, and I can try and find some for you. So there are some articles and trials specific trials looking into low levels of iron and the opportunistic bacteria. The other thing as well is leaky gut and nutrient absorption. So that's going to affect the way our body absorbs nutrients. The other thing is, as we hit mid to late 30s and we have an increased methanogen, so that's an enzyme in our gut that feeds off iron as well. So that's another thing which further perpetuates the iron the low levels are fine in our gut.
Okay, this is a great question. So thank you. Good question, Loretta. If you have high cholesterol and the doctor wants to put you on meds, what are other ways you can address this? I have leaky gut and liver inflammation.
Fixing gut and liver will significantly affect the cholesterol. We can't ever advise against going on medication. You've got to talk about that with your doctor, but yeah, we have lots of patients, and some patients forget to tell us that they've got high. I mean, we always ask, but I've had patients who have just dug up a blood test result from 6 months ago. They had no idea that their cholesterol was high, so therefore they didn't tell me, and then we retested it, and just by working on liver health and gut health, their cholesterol has been perfect.
And Amrit said that her issue is a chronic issue. So again, so that's really good. Amrit is the one, and Amrit, I'm sure I'm really battering your name, and I'm sorry if I'm saying it the wrong way, but this is something, again, like if there's underlying overgrown bacterial issues, again, that estrogen can turn the fire on to make it worse than it has ever been, right? And it's largely due to bacteria. Like, we don't have the slide today because it was for endometriosis, but it was really fascinating. We did the slide, we showed the test results of an endometriosis in our seminar. We did a seminar last weekend, and we were talking about how Streptococcus is a really dominant bacteria. Now, some people would think, well, wouldn't that mean I have strep throat right now? But it actually causes a series of other issues. I'm not saying that's the specific bacteria that's causing it, but there are bacteria that largely drive some of these types of symptoms, but you have to weed them out. And it's best to do it with someone who knows what they're doing, because then you can also reintroduce good bacteria and then help your body get back on track. Okay, so I'm just gonna take one more question. Okay, Michelle asked, do we see teenagers with menstrual conditions such as a 15-year-old?
Absolutely, yes. We see all ages. We see mostly the perimenopause and childbearing ages, but we see all ages.
Yeah, awesome. All right, so how do we actually fix the problem? And you guys can ask questions, and we'll stay back for a little bit to ask questions. And thanks for everybody chiming in and asking questions. And I hope I can actually go through some of these. I'm going to go through a little bit of our process, and then I'm going to bring Tion in a little bit because she's been in the clinic all day. So I want to make sure I help sort of lead us to where we need to get to go so that you guys get the most value from this time with us, okay? So the very first thing that's really important is the way we do treatment is much more, it's symptomatic versus corrective. So can you talk a little bit about like why you go off symptoms versus, just briefly, why you go off symptoms, and then how do you ease into the corrective care?
Yeah, so what tends to happen is patients come to us because they've got a set of symptoms and they've been to lots of other practitioners and doctors, and I'll try and keep it as brief as possible. But I've studied the mainstream medical science way, and I've got a lot of respect for doctors. But they're fantastic when it comes to emergency medicine. So if you have had a serious car accident, or if you've cut yourself really badly and you need stitches, or you are having a heart attack, or you've collapsed a lung, it is exactly where you need to be. But when it comes to these symptoms pictures, it's not really their area of expertise. And a lot of people have symptoms and they go to the doctor and the doctor runs some pathology and nothing comes up on pathology. It's because those symptoms have not manifested into a disease state yet. And if it's not yet manifested into a disease state, it's not going to show up on pathology. So what happens is you might experience a set of symptoms. Let's say you've packed on the weight and you're not sleeping. So you go to the doctor and the doctor runs some basic pathology, everything's perfect, and you're sent away and told to eat less and exercise more, and here, have some sleeping tablets. And maybe you're depressed, here, have an antidepressant, and off you go. A couple of years later, maybe this time you're suffering migraine headaches and joint pain, and they run some blood test results. Test results are fine, you're given a clean bill of health, and off you go with some painkillers. And then 5 or 10 or 20 years later, you go back to the doctor's office with another set of symptoms and you're diagnosed with something. Now, our body has this amazing thing that it does, is it gives us symptoms. It tells us that something is out of balance. We don't just wake up with a condition or a disease. Our body tells us long before that disease crisis sets in that something's out of balance. And in terms of symptomatic care and corrective care, now, we have been grown up in a society to band-aid things, and we can band-aid things with prescription medication, and we can even band-aid things with alternative supplements and herbs and things, which in a way is fantastic. It's great. We can help that patient symptomatically, but really the reason why our patients can walk away 3 months, 6 months, 12 months down the track with a significant result and hopefully a complete reduction in the issues that's going on with them is because we really focus on what the underlying cause is with what's going on with our patients, and we can build a very, very comprehensive corrective care protocol so that that patient walks away healed and with a newfound, you know, our goal in our clinic is to help our patients not to just be disease free, but to have an amazing amount of energy to give life back. You know, I actually got really teary yesterday in one of my consultations, and I told Carrie, and I was really teary. I was really teary about it because I had a consultation with a family, and I've been treating the whole family, and just for the first time in their life, they're actually able to have so basically their son has had a significant amount of depression, anxiety and behavioral issues, and for the first time he's actually completely symptom free. He's got no diagnosed conditions, but he's completely symptom free, and he's just got such a beautiful relationship with his family now. So our goal in our clinic is also to help and improve the quality of the life of our patients.
Yep. And so I'm gonna put this out here now. We're gonna keep talking through it, okay? We're gonna talk through the process. I'm gonna keep Tion working with me through it as we talk of it, okay? But the one thing we wanted to offer tonight is we have an initial consultation. It's typically $197. I'm gonna talk through, because Michelle just popped through a really good question about like what is the real true cost. We are hearing over and over again that people are seeing other practitioners or doctors, and they've spent a lot of money. So we have set up a very economical treatment protocol so we can actually take you to the finish line, okay? The very first step, we want you to try us out, and you're gonna see the difference in the experience. When we go through your symptoms, we're gonna really look at like what the heck is going on. Is it bacterial or is it hormonal, right? And like for someone that's just having the hot flushes and you're still having them, Crystal, you might only need to come to one visit and get a bottle of herbs, and then if you need more of them because they come back, then you just call us back, right? We're going to be very honest, and we're going to be very realistic with you, and we're going to make it work for you so that we can get you to the finish line. The patient that Tion, the family that she was just talking about, they have been budget conscious, so we've literally worked with them to actually help them get to the finish line, get them to the result. And if that means we need to kind of space things out or work things out with you, we understand, and we want to help you, and we want to make it realistic for you too, okay? And so the very first step is you can book in a initial consultation. Like I said, it's only $167. This link down here, I've made a shorter link that just takes you directly to the page. After you do the initial investment of $167, it'll take you directly into our practitioner's schedule, and you can actually book your full 1 hour initial consultation. Then you'll get a pre-appointment form that you will fill out. That'll take you about 10 to 20 minutes. And that form's really important. We want you to fill it out completely and correctly so that we can, you know, have all the notes on you. And we'll also use this as a resource. So if any of you have asked questions, we make sure to get them onto your actual appointment so that you aren't having to repeat yourself 1,000 times to actually have it. The other thing that's important is we do put together programs, which I'm going to talk about in a second, where if you can see that you want to do the program, we can actually apply the investment from your initial consultation to your treatment program. So this is the most you're going to ever spend on a consultation with us if you go into a treatment program. If you only need to come to us once, fabulous. Wouldn't that be great, right? But we really look at how do we quickly get to the result, and because we're so experienced, it moves a lot faster, okay? So you can go to this link. Again, I've made it a short one. It's just bit.ly/3S for snake, U for umbrella, D for dog, V for Victor, A for apple, D for dog, okay? But I'm gonna keep moving because I want y'all to understand more of our process. But if you're ready and you want to just go in, like Michelle, if you want to book a time for your daughter, you can do that now, okay? So let me just make sure we keep moving. So the first stage that we work with you on is really about the symptomatic care. By the end of your first appointment, you actually get a treatment plan, and we set you up on what are the realistic stages, okay? So like this is stage 1. So what's the first thing we need to cut, right? So do we need to go straight to the bacteria and do the weed seed feed, or do we need to start to address the hormones, or do we need to go like straight to the mineral and nutrient levels? Is there a malabsorption issue, right? So we talked about a lot of these things tonight. So we literally bring them through the stages for you, and we set up a realistic timeline with you to be able to do that, right? Why do we actually get results? So Tian, I want you to kind of talk through the car analogy that you said the other day. I really like the way you put that. So can you talk through how we are more like a car mechanic than, yes, we're specialists and we're very good, but talk through the car, because I think people will understand why it's important to take that approach.
Yeah. Okay, so don't take what I say, don't hold me accountable for what I say. I'm actually really terrible at knowing what's wrong with my car, but so imagine you've got something wrong with your car. So imagine you put the keys in your car, you hear a rattle somewhere on the bonnet, and you just keep driving, and then you're halfway to work and your car breaks down. So the tow truck comes, takes your car to the mechanic, and the mechanic says to you, look, there's nothing wrong with your car, you've just got a flat battery, and they change the battery, and then off you go. And then 2 weeks later, you're driving to work, and then your car breaks down again, and the tow truck comes again, takes your car to the mechanic, and the next mechanic says it's your alternator. Then a couple of weeks later, your car breaks down again, and the next mechanic says it's the engine. And then every mechanic says something different. So until a really good mechanic has a really thorough look at how the engine works, how the electricals work, exactly how your car works, you're always going to have issues with our car. And in addition to that, we're highly educated in our society to take really good care of our car, put good petrol in our car, get our car serviced regularly, but we're not necessarily educated in our society to take good care of our health. And we can kind of link the mechanics to practitioners. And I see it all the time in the clinic. You know, you might go to the gastroenterologist because you've got IBS, and because you've got gut symptoms, and the gastroenterologist said, yeah, you've got IBS. Most people have IBS, there's nothing you can do about it, off you go. And then because you've got IBS, that's affecting your skin, and you've got skin issues. So you go to the dermatologist and you say, I don't know what's wrong, I've got really itchy skin. And the dermatologist said, that's eczema or psoriasis. Here, put some cream on it. And off you go. And because you've got gut issues and skin issues, you've got hormonal imbalances. So you go into the endocrinologist or the gynecologist because you've got hormonal symptoms, and the gynecologist puts you on the oral contraceptive pill. And we've got all of these practitioners who specialize in different areas, but until a really good practitioner has a really thorough look at exactly how the gut affects the hormones and exactly how everything is connected, we're always going to be running into issues, and we're going to be going to different practitioners for different things, when actually we're one body, and we need to be looking at the one body holistically. So that's my car analogy that I spoke to Carrie about the other day.
Which is really the whole body approach, right? So
yeah.
we use a combination of 4 things. And Michelle, you've just asked a really good question. Do we see people in person or online? We do both. We have a hybrid clinic right now because of COVID. We are being a bit more cautious than I think we ever have been, largely because we do have patients like Sharon, who are potentially, we need to be careful with immune compromisation. So we typically do bring you in for like when we need something, but we do a lot of Zooming. So this first consultation, which is the very symptomatic consultation, is going to be a Zoom consultation. Or if you don't know how to use Zoom, just let us know so we can set it up. So we either do FaceTime or we do Skype, whichever is like better, for you. We do a video because we want to see you, and then from there we move into where if we need to look at pathology, we'll write referral letters, or we actually have pathology. And we even have pathology that digs in. You might have to poo, just a forewarning. We have some people here who've had to actually blow their breath and urinate on things to find bacteria. So just so you know, it's some weird tests we do, but it helps us find the things. And we can use Medicare tests too. So if some of you are budget conscious, we do that. But we do have in-clinics. We do have clinical locations that we see patients across Australia. Basically, we use it as we need to bring you in because we have special test equipment to be able to do specific things if it's needed. But we do work both ways all across the East Coast. We aren't quite in Perth just yet. Their COVID restrictions have been a little bit harder for us to get through, but we're getting there. We are getting there. So hopefully that answers your question. So stage 2, basically once we get out of the symptomatic part, we want to identify like the key issues, okay? Then if needed, we move into the pathology and the corrective treatment. So that pathology, like I said, it could be through Medicare. We often use referral letters, like Hashimoto's, for instance. Like we just had a patient who for 15 years has, ever since she had a baby, she's known that something isn't quite right. And basically, as a result of that, she has, she like couldn't get any answers from any of her doctors. Sorry, I looked at the question part. I'll be back and I'm here. I just got diverted, so I apologize for acting weird. Anyways, Tian did a antibody test on her, and sure enough, she had Hashimoto's. It's taken her 15 years, and we were the only ones to actually get it tested. And you can actually get those tests through Medicare. You just need to ask for it, right? And it's easier.
And we can write letters.
Yeah, we write referral letters all the time. Even a lot of like the nutrient stuff, we can actually get tests. We can look at hormones and things like that through that, okay? Stage 3 is really the long-term restorative care. Now, this is really important. The way that you eat, in the end, you can do so much with prevention. And I don't mean like, for me personally, like I actually was too clean at one point and I couldn't, like I got to a point where I got a plateau and I wasn't even losing weight anymore, right? Because I actually wasn't having enough carbs. So like I share that with you because part of this long-term restorative care, it's not about you needing us forever. That is not our intention. We're here to help you solve the problem and help you know how your body works, how things really tick. And to be honest, this is the reason that I work with Tian, is because I don't think you need to be dependent on us, and you shouldn't need to be dependent on the doctor. And now after COVID, I think it's even more important that you understand how your body works and you understand what you can do, because you need to be in full and complete control of how you work and your best advocate for yourself, right? You need to be a little more educated, which all of y'all are here tonight. And seriously, I know it takes a lot to make time to do these things, but if you learn about your body and what your body needs and what it doesn't need, you can literally do so much correction with food, and you'll be able to feel into what you might need more of. Or if you're not, or if you're noticing that you now know that you naturally have a malabsorption issue and you don't absorb iron very well, then you might say, okay, I don't really want to eat 100 red steaks or 65 kilos of spinach every week. So I'm gonna, take an iron tablet, and but how you take an iron tablet matters. So some people take iron tablets every single day when that's not actually the best way to actually absorb the iron, right? So it's about learning how your body actually works. And that's why we do this sort of final stage. Realistically, most of our patients have been, we see most of our patients anywhere between 3 and 6 months. So Michelle, we definitely can do an in-person appointment. You can actually go through that link. She's in Sydney. So that link, you can go through there, but I'll also we'll put, if some of you guys have more questions, that's a good question, Crystal. I'm about to get to the other questions, okay? So just to tick, if you guys want, we might need to pop on a call, and I kind of knew that was going to happen, but if any of you are, like, if you're ready to just book in and get in and you're happy with Zoom, then you can jump on the link. But if we need to pop on another call to schedule a different kind of appointment, we can, okay? And Crystal, I'm going to get to you on the return consultations because that's part of the program, okay? And I'll talk through tests. So couple things that we've seen, just to briefly go through this. We're seeing a lot of bacteria that's driving the insulin resistance. And like Carol suffered for 15 years, and she actually had a specific type of bacteria that thrives and literally is kind of like an instigator, like a pilot light for insulin resistance. So she was on the road to pre-diabetes if she didn't actually deal with it, right? And this is, you know, this is, again, this can be part of that sort of next step, right? Adrenal fatigue. Right now, we're actually seeing a patient who saw another naturopath for 3 years. The naturopath only ever looked at hormones and adrenals, which unfortunately is really common in the liver. And she hit perimenopause. Everything kind of spun out. And sure enough, we did a SIBO test on her, and she has SIBO. And she emailed through the other day, and she's so happy because she feels like she's 20 again, and she's a single mom of 2 kids. You know, this is big stuff, right? Another woman who, you know, has come through, she's been on bioidentical hormones, which are very expensive if any of y'all have taken them. And she's been taking them, that's, you know, about $100 a month for the bioidenticals, plus $250 every 3 months to go and see a specialist integrative practitioner, and that, not practitioner, integrative doctor, and that doctor is literally not even looking at the gut. Things are still not working. She's still having symptoms. She's better, but she's had huge bacterial inflammation that she knew about, but no one actually addressed until she came to us. And now she's feeling way better. Another one, this one's really hard for me. Graves is real, and a lot of women with endo get Graves. And this particular patient only ever had her thyroid looked at, and she had SIBO. And for 3 years, she paid every single month to get her Graves dealt with, and she had SIBO.
Can you quickly say what SIBO is?
Yeah, so SIBO is, you say it.
Oh, it's small intestinal bacteria overgrowth, just for those of you who don't know. So it's when the bacteria from the larger intestines overgrows, and then it moves up to the small intestines, and it overgrows, and it causes significant amount of inflammation. It affects the whole digestive process because it's further up. And symptoms include potentially nausea, diarrhea, constipation. Most IBS cases are actually small intestinal bacteria, caused by the small intestinal bacteria overgrowth. And it's something that we can treat with 100% effectively.
Yeah, so and Graves is a big one. Graves is hyperthyroid, right? So that's a really challenging one to live with, okay? So how much does this cost? So Crystal asked the question, okay? So these are the different, I like to kind of help people understand it. If you've only ever seen a doctor, this kind of puts it into perspective. Just rough costs, your monthly cost on HRT is between 20 and 40 bucks. I just read in the ABC today, they published an article saying that the amount of antidepressants that they're currently diagnosing is like 300% more than they've ever diagnosed before. And this is the most famous diagnosis for perimenopause, unfortunately. You do get free reference ranges, but unfortunately in the traditional medical system, you get like life, death, immediate response. If you were to go and see other practitioners, what we often see is they stay in stage 1, which is the symptomatic approach. Most of them don't ever get to pathology. Some of them do. I see some of you, like Crystal, it looks like you've had pathology done, which we'll use. That'll save you heaps of money. And basically, they over test you. So there's a particular clinic, unfortunately, we see a lot of that. One lady today spent $5,000 on tests and she doesn't feel better yet. And it's because nothing was ever looking at the gut, which is really hard. So you might spend 500 to 800 bucks at the first appointment on your consult and all the supplements you'll walk out with other solutions. That doesn't mean it has to be a naturopath. It could be an integrative doctor or something like that. And then that gets really overwhelming because you have way too much stuff to keep up with, like a bag full of 6 or 8 things, which is really expensive. Or you'll go in to get pathology, and then you just get a symptomatic approach to fixing it. There's no real long-term restorative solution that empowers you to go on a diet, right? Or get into a specific, when I say go on a diet, I mean eat a certain way, right? At our clinic, the first consultation is $167. Our average remedy cost at that first consult, I pulled the numbers because that's what I do, is about $180. Some people are less, some people are more, like I've seen as low as $50. I've never seen more than $200 because the worst thing we could do is send you with so much stuff that you're overwhelmed. This is symptomatic, right? So we don't need to go too crazy, and we literally prescribe based on where you're at in the journey, and it really keeps your remedy costs quite down, right? Then from there, if you want pathology to pay for functional pathology, we can do a lot, like we said, through Medicare, and we can send you with referral letters for lots of this. Crystal, if you still have tests, we can actually use those tests so you don't have to pay for more, unless we need to look at bacteria and you want to. But because we see so much bacteria, this is why I'm talking about it, because Tion she might say we're gonna have to test everything, whereas because we see so much bacteria, we do test, but we are able to identify what's going on fairly quickly because we see so much of it, right? You're getting a practitioner who it's kind of like, you know, brushing their teeth every day. They pretty much know what's happening and they can rectify it. And they can get aggressive as if it's the worst kind of bacteria if you are mindful of cost. Because at the end of the day, long-term restoration, if we're budget conscious, is the goal. So we will help figure out how to get it done and whether or not you need to get pathology. Most of our patients are on 3 to 6 month plans. We can often like bundle in an initial, it's anywhere from somewhere between $500 and $900 for, you know, for consultations, and then remedies you typically tailor off unless you can't do it with food, okay? And the remedies you pay per consult. And we have payment plans if you need to pay as you go. We can do payment plans if you need to do that, okay? Oh, did you stick this on there? Oh, this is a secret surprise. Okay, so here's a little, here's a really interesting bacterial, this is a different thing here. Okay. Anyways, doctors, you can't see this, so I'm just gonna have to talk about it. That's really interesting. Doctors typically, if you were just to be prescribed to insulin, let's say you actually have insulin resistance, what's behind here says, you know, you would basically have, you'd spend $1,800 over 5 years. Whereas if you actually have us help you, you actually get the restoration. You don't have to get dependent on insulin or any of those things. And that's just insulin. If you were to go on bioidentical hormones, you could be on bioidentical. Sometimes they don't even take you off. We had one lady who was on them for 10 years. Whereas with us, it's, you know, all in all, we try to keep the program anywhere, you know, in total spend between no more, like anywhere between $1,000 and $2,000 over that 3 to 6 month period of time, okay? And again, I'm overestimating because I would rather us under promise and over deliver, okay? Here's just a few things that our patients are saying, and we might be able to do it in a shorter period of time. Like some of you just need a couple of things. Trying the initial first helps you really understand where you're at and what you can expect. Here's just a couple of what our patients have said. One of our patients said, Dana said, lost 12 kilos in 3 months. Now 6 months later, she's actually been able to maintain it. This is really common. I was bleeding for 4 to 5 weeks at a time, then 1 week off. She's a lawyer, so that wasn't on. And in the first month of treatment, she bled for 6 to 7 days and went 26 days of not bleeding. This is another really good example. This is a patient, she's tried just about everything, and she lost 12 kilos easily. Her energy is much higher. Her headaches have pretty much gone, and she doesn't need the painkiller anymore. Carol's journey after what is going on here? Okay, it's like doing its own thing. This is fun. Carol's own journey, she lost an average of 1 kilo a fortnight. Her bloating gone, her periods are normal, moods are normal now. She's perimenopausal, so she's not at menopause yet. Her energy's restored, she's sleeping through the night, and her hormones are all within optimal range. The moods are the big one. This one had H. pylori, right? So like moods and H. pylori are a really big deal, okay? So the real question to ask is, if you don't try this, right, and you don't want to do it, what's the cost on you for continuing to either not have energy, not have your mental clarity, not sleep through the night, have that excess weight? It's heavy, we know, because if you've got that insulin weight, boy howdy, that is some heavy weight. Not being able to chase your kids around or your grandkids, or being able to keep up with them and be able to walk. You know, most menopausal women, there's a running joke, they can outwalk the men. They have more energy. Like, there's this freedom that happens with menopause, and the energy and the resourcefulness. You know, menopausal women are actually, back in history, they were the most effective women they were the most effective part of the family. And if you look at the way the Chinese family is structured, it's very, very similar. Obviously, I read a lot about history, and it's the most functional member of a family unit, even to date, is the grandmother. And it's largely due to the fact that she takes a lot of responsibility. She makes more meals, she cooks more for everybody. Like, she's a really important part of the whole family unit. And during menopause, there's a lot more energy. There's a lot of benefits. You may become more direct because you don't have all that estrogen, right? And there's no reason to be tired, and there's no reason to be hurting with headaches and pain. Like, all of this can be rectified by dealing with the bacterial, right? So I want you to really think about, like, what's the cost of it, and just give it a try, right? So you can try it. It's only $167. And if you're not happy, come to us and we will make it right, because this is our word and this is our clinic, and our reputation is more important than anything else, right? And we want to make sure we get awesome results. That's our big thing we say here, is everybody leaves with really awesome results. You can actually see the difference for yourself. And really, is it worth $167 just to start getting some answers as to what is going on? The amount of patients who come to us who think they have a thyroid issue, who think that they have a different kind of issue, that actually don't. They actually might have something else going on. Like, I actually thought I had diabetes, and I thought I had insulin resistance, but I had estrogen dominance, right? Crazy estrogen dominance. And then as soon as we dealt with it, it sorted it out right away. So I'm going to come back to questions. Guys, I highly recommend, if you can, to book in. As a bonus, it's not up here because I forgot to add it to here, but as a bonus, anybody who actually books in tonight, Tion, we haven't actually released this to the public yet, but if you actually make the next step and you decide to book in tonight, we actually, Tion created an amazing diet guide that literally, it takes you straight through the 3 phases, and it goes through what to eat for gut health, what to eat for hormone health, what to eat for liver detoxification. So as you go through either your program or just after your initial, we're going to make sure everybody gets a copy of that. Literally, when it goes to market, we haven't really marketed it to anybody yet. You'll be the first to have it. Mm-hmm. It's going to, literally, it's something that it normally would retail for $197. But if you move forward tonight, we will give you that after your consultation, so that you actually have a resource that walks you through what to eat, and you actually have a guideline for what you should be including, okay? So you can organize that at bit.ly and then /3SUDVAD, okay? So Crystal asked, how much are the return consultations? How much are the tests that I need? So we do support patients all across Australia. We would start with you over, we would probably start with you over Zoom. And then we can work out like when to actually see you. But we would rather, like, for you, based on what you've said so far, Crystal, especially with like your hot flushes and things, we might just be able to literally ship it straight to you, okay? And am I able to do this from Perth as I cannot have a face-to-face? Yes, Sharon, you can literally book into the link. It'll bring you straight into the Zoom schedule, and we can do everything over Zoom. We do like to see you at least the first time. We can call you if you're not very good with video phones. Yeah, okay, you're finding it difficult to type in the link. Yes, I'll type in the link here, so just give me 1 second. Good response. Michelle, I'm gonna send you a link so that you can, okay. Okay, so the link, Michelle, thank you for bringing that up, has said that the consultation says it's with endometriosis. So it's obviously connected to the wrong booking, but it will take you into our consult. It is with a perimenopause, with our perimenopause person. So it just, I'm sorry about that. That's my own, I'm the technical person and that's my own mistake. So you can actually book in with that and we will make sure it goes through to the right person, okay? Crystal, yes, I know you live in the Northern Rivers. We can actually, I'm gonna send you something we can connect over the phone. That might be easier, okay? So if you guys see that it says endometriosis, that is a technical problem that I have made a mistake with. It's actually an initial consultation, and it is, I will go back and check and make sure all of you guys get with our perimenopause practitioner, okay? And then Crystal, you asked for the link. I'm gonna put it in here. 3SU DKVA.
No, DV.
D. Okay, thank you. I'm putting it in now. See, I got my tech expert sitting next to me. Okay, so I've just put that link in. And Sharon, you can go to that link too. I think I've just sent it to everybody. So I hope you guys have gotten a lot out of this, and I hope it's been really helpful. Thank you for those of you who have said really nice things, like Tracy. Tracy had a question. I'm 44. I thought you just said loving this. Thank you. I'm 44, and around 2 years ago, we'll answer a couple more questions. We're running way over time. I hope that's okay for everybody. I'm 44, and around 2 years ago, noticed mood changes, especially closer to my period. It led me to getting the Dutch test done, checking out my HPA axis, cortisol levels are the issues, doing what I can to limit stress. Very curious to know about investigations in the gut microbiome and thyroid status. Also aware my liver is sensitive and have known this for a while. Yeah, Tracy. So again, like really, if you're open to it, let us do a bit of in your symptoms assessment. Let's look at your gut stuff. What's really interesting is a lot of women will start to see like rosacea, and they'll start to see stuff on their skin, and it can actually be like a lot of women get told they have rosacea, but it's actually a manifestation of something that's happened hormonally, and it can get switched off. It's and same with like fibromyalgia. She kind of ran through, but fibromyalgia, like many doctors are now saying it should never be diagnosed in perimenopause. Rosacea shouldn't ever be diagnosed during perimenopause. And some people actually have like what looks like aging spots, but it actually can be like mineral, like your body's not balanced. There's actually a problem with it, which is why it's like if we can look at it from a symptomatic perspective and dig a little bit deeper, you might actually find that it actually has something else to do. And you're born with jaundice. So like you could just naturally have a, you could naturally have a very weak gut constitution, which makes this season a little bit more complex, but it's important because addressing it during this perimenopause season is what actually is going to help you sort of set yourself up, because these symptoms are all appearing to let you know that something's still not right, right? So it's really important for you to, you know, keep moving through it and to get help. And as symptoms come up, like Tian said, really, you know, get the help, okay? Okay, Catherine said, would you be able to address the 2 questions I've put forward either tonight or get back to my email? Let me have a look to see your question. Okay, sorry, some of y'all's questions didn't come through fully, so I didn't see them. My sister is 45 years old, and 2 weeks lead up to her period, her sinuses and allergies exacerbate, along with the headaches and episodes of heightened anxiety and feelings of overwhelm. Is a histamine response occurring or inflammatory stress occurring? Why is this happening? She's been having episodes post having her child. He's now 9. She had preeclampsia, had an emergency C-section, extreme blood loss, and never really fully recovered. You want to answer that?
Yeah, can I read the question?
Yeah.
Maybe we can answer this via an email.
Yeah, we might need to answer it. So Catherine, maybe like if some of you guys still have questions or you have a friend like that, we would love to. Oh, Monica, you just made me smile so big. We're gonna, if you still have questions, we can reach out. And Michelle, we'll go and we'll have a look. If you want a consultation, please book in. Then we can literally, if we need to call you and get more information, we will. And then for someone like Catherine, your sister, that's a really big question for you to be asking. And it'd be good if she actually cares and wants answers. Maybe we can pop off and actually do a little bit of an introductory consultation with her and be able to kind of answer questions specifically to what is going on for her if she's open to it. So I'll send you an email back so that we can organize something like that for her. Okay. Okay. Lichen sclerosis. Okay, let's have a look. We're gonna literally try. So Tanya asked a good question. How do we work with patients from interstate? So Melbourne, we literally are gonna start seeing our patients in Melbourne again, face to face. We are doing a lot on Zoom still at the moment, but we have organized next month where we'll actually do tests and bring people in and actually do more face-to-face up there. So what I would suggest, Tanya, very good question, is let's do your symptomatic part. Let's get your test going. And then literally, once you get your symptom stuff started and we get that out of the way, we can actually do if we need to do in-clinic tests or just meet and see each other face-to-face, typically that 1 month mark is really a good time for us to do that. So we do a lot on Zoom right now. And then we're like I said, we're working in a very hybrid approach where we are now getting back into the clinic. But we have to be very careful with all the COVID stuff with immune compromisation patients. So we'll do a lot over Zoom, and it's actually good for all of y'all that are interstate or not, you know, or in, you know, different areas, and it takes an hour to get into the city. The Zoom actually saves you a whole lot of time too. We find everybody as much as we love seeing patients face to face, we get calls all the time saying, can we just Zoom? So just, you know, it's very convenient. Yeah, okay, so, oh yeah, you would have to. Okay, Catherine, we're gonna email you. Well, I'll email you through the, I'm gonna email you through the, you had another really big question. So I think we need to answer the other question because that's an actual diagnosed condition. We'll come back to you over email. Okay, so I hope I answered y'all's questions around testing and budget and things. Typically around the test, just to kind of go a little bit further, we don't typically prescribe you get 10 tests at a time like some other places do. If you need to get functional tests, we really only get the ones that are specific to what we need more information on, and we use as much of the Medicare tests as we can.
We actually only refer about 50% of our patients on for further tests. And then about that 50% of those patients, about half of those patients, we can get tests done on Medicare. And it's approximately about the 25% mark of patients who may need to pay for tests out of pocket.
Yeah.
Just to put that in context. So we talk a lot about further tests, and we will always recommend it if we really feel like it's necessary, but it's not in every situation.
And I think for me, the other big reason I'm talking about the money part is because in the past, people feel like they get stuff sprung on them, and most of you are at a point where maybe you've tried some things and it's been expensive. So we'd rather be upfront, so we talk about it, and then we can just focus on getting you better and actually put you into a real results-focused program that then you can walk away with knowing how to work with your diet. And if you need bits and pieces in a year, you can still come back to us and we can send it to you. We're not going to hold you to forcing you to have an appointment all over again, right? You might just need nutrients and things because we're so familiar with where you're at. So yeah. Do you use hair mineral analysis? Some of our practices do use hair tissue mineral analysis. We actually find it depends on, okay, Crystal, I'm gonna give you a ring and as soon as we hang up, and then we can organize a different time. If you can't find an option on a time, we'll ring you right back. And we're probably gonna have to ring you regardless, because we probably are going to want a little bit more information from you as well. Okay, Crystal? Do we use hair tissue analysis? Sometimes, yes. It just depends on your situation and what you need. So we have a really good, we've got some good blood tests for minerals if we need to do it. And based on everything you've said so far, it would be very premature for us to say that minerals would be the thing for you, right? So we'd want to dig a little bit deeper on that. Monica said, I'll do as many tests as I need to get that postmenopausal Victoria's Secret job I've always wanted.
Cute.
That's right. That's right, Monica. That's right.
And that's it. Some people come in and they've been to so many practitioners. Like Carol, she just said, I have been dealing with this. It was actually about 16, I think, yeah, more than 15 years she's been dealing with that. And she just said, I'm so sick of just going from doctor to doctor, naturopath to naturopath, so many practitioners, and we didn't do everything. But she just said, just go ahead with everything that you might think applicable. So we're not going to refer you for any tests that are not applicable, but many people come in and they just want answers. And, you know, that's what we're here for. We're here to get answers, and we're here to put together a really awesome solution so that you walk away with really good results.
Yeah. And hopefully you can see, like, when we have patients, like the periods changing that quickly, the hot flushes going away that quickly, the endometriosis stuff, when you see the bacterial stuff coming up, whoa, howdy, man. I mean, some of the patients, and this might happen for you, if you've got bacterial buildup, we have patients who literally have fungus start coming out of like their pores in their face. And it sounds really disgusting, but you're shedding this very bad inflammatory bacteria and it's coming out. So yeah, so I hope y'all have got a lot of value. I do know that there's some questions that we haven't answered. I'm going to go through each and every single one. And we will, if we haven't gotten it answered, we will endeavor to get back to you to help you. And thank you so much for your time. Thanks for staying so long with us. And if you haven't already, please go ahead and book in that initial consultation. We're going to be in touch, I guarantee, pretty much regardless, because it sounds like we might need to do some jigging with schedules and things. So Crystal, I'll reach out to you in just a tick, but anybody else here, once you book in, we're probably going to have to talk to you just for a minute to get a bit more information and make sure you've got your symptom survey and everything else. So thank you again for your time. Yes, Michelle, I will I'm going to send you something in just a second. Thanks for your time. Thanks for being with us tonight. And yeah, I'll stay on for just a couple more minutes so that, oh, okay. All right. Yep. And yeah, if you book through the website, Tracy, I'm going to send you something right now. Michelle, I'm going to send you something right now as well. Okay. So just give me 2 ticks. I'm going to send y'all a direct link. So just give me 1 second. And I'm going to stay with you. And then if y'all want to ask more questions or anything, or if you want to pop off, you're welcome to leave. Oh, great, Monica. We're looking forward to working with you too. That's brilliant. All right. Okay. Yes. Michelle, I'm answering your question right now, and Tracy, I'm answering your question right now as well. Okay. Yeah. So if you book online through the link, yep, you will get the book and everything else. So hold on. And you don't have to pay $197 just because you are happy to do it. We're doing the special for everybody, but that's really sweet of you to say it. Hopefully y'all got lots of value, and we want to give everybody the special offer. You can organize. Michelle, I'm typing back to you right now. If you're having trouble with the link, or you want it, or you need to book just a quick phone call with us, let me know in the questions, and I'm typing back to you now. So Michelle, I'm sending you the link right now. Okay. I spelled that right? Okay, Michelle, I just sent you the link. All right. Okay, Tracy. Can you put your phone number in here? And Crystal, we're going to ring you in just a tick, okay? Give me 2 seconds and I'm going to ring you. I know it's getting late, but I will ring you in just a second. So Tracy, can you please put your phone number in here? And then I will, because something might just be happening on your end, so I can help resolve the technical issue and we can get it all sorted for you. Okay. All right. Yeah. Okay. So Emrit, I'm typing the link right now for you. You want to type it in and make sure it works?
Yeah. Yeah.
Tiana's going to type it too, just to double check it. Oh, good. You got it online. Okay. That's good, Tracy. That's really good to know. Okay. All right. And Michelle, did you get the, I'm assuming you got it because you said thank you. So you can go in through there. Amrit, did you get the link okay, darling? Okay. Okay. Thank you for your number. And okay. And Catherine, we're going to come back to you. Sharon, you had a lot of questions too. We're going to come back to you. And if you're in WA or in Perth, we can help you as well. We just will do a lot through pathology, and we can do it. We actually are so used because of COVID with the Zoom. Okay, that's brilliant, Michelle. Thank you. Okay. Amrit, may I please have your phone number? Is it working for you?
I'm not sure.
No, it's not bit.ly.com. It's just bit.ly /
Yeah.
And then, okay, Amrit, will you give me your phone number, pretty please? And I'll, we can just do it over the phone. Awesome. Great. Thanks, Michelle. Is anybody else having dramas with the link or need anything else? Okay, brilliant. Okay, Amrit, I will give you a buzz now. Okay, anybody else having trouble with the link or need any help with anything? I'm gonna give us 1 more minute, and then Amrit, I will give you a buzz, and then I will give, or then Tion's gonna call Crystal to make sure we get your appointment all organized, okay? Awesome. Okay, so I'll just stay on for a couple more minutes in case we have any more questions. And thanks again for everybody coming this evening. And we're so grateful for your trust. And we cannot wait to start working with you. And we can't wait to see your results. That's why we do what we do. Your results are going to be amazing.
Yeah, thank you so much, everyone, for joining us.
Awesome.
It's, we're very excited to work with all of you.
All right. So I'm going to give it until 7:14, which is 14 minutes past the hour. And then I'm going to sign off for the night. So if anybody has any other questions, pop it in, give us your number, and that way we can ring you if we need to ring you, okay? All right. So I'm gonna give you Crystal's number, and then I'll ring Amrit, okay?
Yep.
All right. So that's it for now. Thanks again, guys. Really looking forward to working with you all, and we will see you very soon and be in touch. Thanks so much.
Thanks, everyone. Bye.
Bye.